Cervical cancer. It's a very common thing. 10, 11,000 diagnoses of invasive cancer per year in the States. Um, 3.5, 4,000 deaths per year. Uh, North American rates of death are actually are fairly low because it's caught earlier here. Um, the uh, the rates are declining definitely, and definitely the deaths because more screening we understand more of it. Usually, fifth decade uh, sort of thing, and people get it. Uh, it seems to be uh, lower socioeconomic status seems to be part of it as well. Uh, it's related to infection with HPV, genital warts. Uh, Lots of people have genital warts. It's a fairly common thing. Not all of them lead to cervical cancer. Um, and it causes dysplasia, which is precancerous change, and that's what they're actually looking for when they're doing the Pap smear. The Pap smear has helped a lot in um, early diagnosis of this, and you'll hear people say, "Oh, well, there are abnormal cells in my Pap," and this is what they're talking about: the dysplasia, the precancerous changes. Um, that's yeah, that's what they're looking for. So now, what most people don't understand is that HPV is one of a whole bunch of different. Well, there's a whole bunch of different viruses that can cause genital warts. Some of them are low risk and they don't lead um, to cervical cancer. Some of them are higher risk. So yeah, and then they can spread those. That cancer can spread. So one of the risk factors then becomes HPV, which is a sexually transmitted disease. So having exposure to HPV is a big risk factor. Interestingly enough, sexual activity at early age with, and multiple partners seems to be a big risk factor. Now, there's a couple of things like teenage girls. Um, there's a couple of things going on down there. One of the things is their vaginas aren't as um, acidic as women in their 20s, 30s, 40s, 50s. And so the risk of infection is actually higher. One of the things that the acidity and the lactobacillus that live in the vagina does is it protects from infection. And adolescent girls don't have that as much. Another thing is that the in adolescent girls, the the mucus plug isn't as well developed, and one of the things the mucus does is it keeps out some of these pathogens. Um, Presence of other STDs, especially chlamydia, is now known to be a big problem. Um, Smoking and secondhand smoke is huge, maybe raising the risk by as much as 100%. Uh, Other things like immunosuppression, co-infection with other things, low socioeconomic standing, uh, overweight, low fiber diets, yeah, lots of junk food. It seems to put people at risk. The problem with with cervical cancer is that there's not a lot of early signs and symptoms. Um, I mean, later, if it gets invasive, you end up with some bleeding and some spotting, uh, but not a lot of symptoms on its own. But early detection is the key for curing it. So that's where the Pap smear comes in. The Papa Nicolos smear. It was kind of developed in the 1930s, and has been a real success story in screening. Uh, if they find something, then they biopsy it. Um, I mean, there's various other tests that are being developed, but the Pap smear is the really the standard. Um, Best way to deal with cervical cancer is not get it, and the best way to not get it is to practice safe sex. Be careful about STDs, especially HPV. Uh, this uh, the the vaccine Gardasil uh, seems to be the one that's working, and really it it prevents these four types of HPV, 6, 11, 16, and 18. Um, they're the most common four and are responsible for about 70% of cervical cancers. So, I mean, the jury is out on whether they should just be automatically doing all these girls in grade 8. There's that's more of a political debate than anything else. The vaccine does seem to work. Um, so how do they treat it? Usually it's found really early because of these screening tests. So it's usually found in situ or at stage 1, like not really invasive. Um, so really, they basically burn them off. They treat it like almost like a wart with a little cryotherapy. They can do some surgery. They can take off the growth itself. They can excise just a little bit. They can use lasers to vaporize it. Uh, if it gets a little bit further and they're more worried that it's got invasive into the other tissues, they do radiation therapy. And if it's metastasized, they'll do chemotherapy. Just to make sure that it's not spread. They can completely excise the whole thing. They can do a hysterectomy for it, but they don't do that until there's like really advanced cases. So that seems to be more of uh, the issue. Um, as far as massage goes, it's all the same rules that advanced cancers, if it's an advanced found in an advanced stage. So really, worrying about lymph drainage and that kind of thing. You don't want to do circulatory or lymphatic massage. But if it's just in the early stages dysplasia, then it's not really that much of a problem. You're not going to really be affecting that area that much.